Well, back to our OBG class, and in the previous classes, we have seen about the menstrual cycle, in which we have already seen about the two cycles, that is the ovarian cycle as well as the uterine cycle. So now, next, we are moving on towards the next topic, that is, we are going to see on the pelvis. Okay. So, what about the pelvis? Pelvis is nothing but it's the backbone. Okay, and it is the main bone where we need to study our labor. So we should be thoroughly with our pelvis. So in our today's class, we are going to see about the pelvis. Then what are the bones of the pelvis? Then we'll have some learning outcomes and we'll have an exercise. So the objectives of the class will be by the end of the class, the student will be able to explain about the bones of the pelvis and about the pelvis. So here is a picture of an female bony pelvis. You can see in the picture that the baby's head is being shown, so how the baby is passing through, and this is an ideal picture of the pelvis. Okay, so in this pelvis, you can see here the back portion which we see, that is the sacral part. It is having two parts, that this is the flared part. You can see this is the we call them as the ilium bones. Okay, so one by one we are going to see now. So what is pelvis? The pelvis is how it looks like. It is a basin-like structure. How it is connecting the spine, the backside spine to the lower limbs is being connected to the pelvis. And that is an important part of the skeletal system also. Very important part of the skeletal system, as I told you, pelvis, because it is connecting our upper body to the lower body. Then pelvis is mainly transmitting the weight of the trunk. The complete weight, it is bearing the weight of all our upper body on our legs. Then it takes the weight of the body. Whenever we are sitting on the ischial tuberosities. So on the ischial tuberosities, our complete weight is there. So it is transmitting the whole body weight on the ischial tuberosities. Then it also allows in the moments of walking and running. When it is discussing walking, running, okay. Then it is protecting the pelvic organs. The pelvic organs are the uterus, the bladder, the, the main organs. So everything this can be protected by the pelvis. Then in addition to that, the female pelvis, when we speak about the female pelvis, it is adapted for which type? It is adapted for the child bearing, okay, with an increased width and a rounded brim. So the female pelvis is somewhat different from the male pelvis because it is having the wider brim. Okay, so with the wider and round brim, what is happening? We can understand, I mean, so we can easily go to the labor. So next is how we can define the pelvis. Pelvis is defined. It is a skeletal ring which is formed between the two innominate or a hip bones and a sacrum and the pec. So how is the skeletal bone formed? Skeleton is formed with the help of skeletal ring. How it is? That is with the help of innominate bones. These are the both the side, or we can also call them as a hip bones. And a sacrum is there and pec. You see that in the picture. So usually the 5 marks or 10 marks question examination. How many types of pelvic bones are there, and explain the bones of the pelvis also. When they say that there are actually 4 bones of pelvis. Which are those 4 bones of pelvis? The 4 bones of the pelvis are the that is the 2 hip bones, or we also call them as what? Innominate bones. Okay. And the second one is the one is sacrum, and the one is the coccyx. So next comes the pelvis. Okay, so this pelvis, the bones which we have now just see, let us see one by one that you can see this yellowish part, okay, and part, this is the ramus. Okay, it is complete bone, this pink, this purple and this yellowish part, the complete these two are we are calling them as what nominate bones. And the backside greenish part which you are seeing, this greenish part is the sacrum and the lower part of that is the coccyx. You can see in the backside view, in the green color you can see it is the sacrum and a coccyx which is the preliminary bones. Next, you can see here the various parts. So what are the various parts? The first is the sacrum. This is the back end part. Then this is the ilium part. Then this is pubis part. Okay. And you can see this is the ischium. This is where the ischium is there. And this is the symphysis, pubis part. And this purple color, the hardened part, that is the ischium. Okay. The complete part we call it as ilium. Okay. So that is ilium, ischium, and symphysis, pubis. Ilium is the flared part, ischium is the hardest part, and pubis is the where the joint is there. So you can see here there is a joint with a somewhat bluish in color. So this particular area we call it as what? Pubis. Next is the complete explanation of the book. Important landmarks, as you can see. So the sacral promontory, this is, as I already told you, is a region of the bone. The sacral promontory, sacral is or the bulged part, and the second one is the lower end part. We call it as coccyx. Okay, and you can just see a flared part that we are calling it as what sacral ala or wing. We can say. Okay, then this is a curved portion. This portion is called as what the iliac fossa. Okay, then there is a crest where our hand is resting. That we call it as the iliac crest. And in front of, you can just see that there is an anterior superior iliac spine on the frontal aspect, and on the back aspect it will be the posterior superior iliac spine. Just below the anterior superior iliac spine, there is one more spine that we call it as anterior inferior iliac spine. And there is an acetabulum, there is an oblique foramina, there is a pubic ramus, there is a pubic tubercle and pubic crest, and the symphysis pubis. The bluish line, the green line which you are seeing is the bacterial line. Okay, and these thorn-like structures you are seeing, these are called as ischial spines. So this is the back view of the pelvis. Okay. The greater notch, the yellowish color is the greater sciatic notch, and the green color one is the lesser sciatic notch. So in between this greater sciatic and lesser sciatic notch, you can see the spine is there. Through this sciatic notch, the sciatic nerve passes. There is an obligator foramina. Then there is a pubic symphysis and pubic ramus. This is and the ischial tuberosity on which we are sitting. That is the green one. Then this is the iliac crest. As I did, similar to the anterior superior iliac spine, we do have the posteriorly superior iliac spine is present. Okay, you can see here the acetabulum where the head of the femur is articulated. So this is the side view. So now let us see about the ligaments of the pelvis. These are very important for the ligaments of the pelvis. So in the ligaments of the pelvis, what are all there? How many ligaments are there? The first ligament is the anterior sacroiliac ligament. In the anterior sacroiliac ligament, as the name is suggesting, anterior and on the sacrum. Anterior sacroiliac ligament. It is attaching the anterior one as well as the sacrum part. Okay, that's why we are calling it as, and from the sacrum to the this one, it is being attached. So anterior it is the so iliac bone. So anterior sacroiliac ligament. So then at the back end you can see in the back aspect we have the sacrotuberous ligament. That was the sacroiliac ligament from the sacrum to the ilium bone. In similar way, we will have from the sacrum to the tuberosity. That is the sacrotuberous ligament. And in the spine, we have the sacrospinous. Means from the sacrum to the spine, it is attached. That is the sacrospinous ligament. Okay. And these are some of the main ligaments of the pelvis. So this is how the bone looks from the front side. You can see here the iliac crest. Okay, the sacroiliac joint because it is joined here. The ilium is being joined to the sacrum, so sacroiliac joint. Sacral promontory because it is somewhat bulged like this way. Then this is the brim. The rounder part of the pelvis is the pelvic brim. There are spines, that is ischial spines, acetabulum, where the head of the femur is sitting, pubic crest, and the symphysis pubis. This is the one overall front picture of how the pelvis looks. So this is how the sacrum looks. It is a fusion of four bones, sorry, five bones. So when the fusion of the bones is there, so they become, they are becoming only one bone, and it is a triangular in shape. Now let us see one by one about the bones. So there are two bones. Which are those two bones? That is the innominate bones. Okay. So the innominate bones are three. We have two innominate bones. Now in this innominate bones, we are dividing them into three parts. First is the ilium, second is the ischium, and third one is the pubic. These are the three bones. Ilium, ischium, and pubic bone. Coming to the ilium. So the ilium is a flared outer part of the hip. And this is following, this is having what? How many parts? It is having the iliac crest as an upper border, and a concave border is called as the iliac fossa, and it is having an anterior superior iliac spine. It is having anterior inferior iliac spine and posterior superior iliac spine and posterior inferior iliac spine. As I told you, the hand where we are resting, that particular part we call it as what? Iliac crest, and that is the upper border. Okay. And the front portion where we feel that is the anterior superior iliac spine. Okay, just below the anterior superior spine, we do have anterior inferior iliac spine also. Okay, and we do have the back side. At the back end, we have the posterior superior iliac spine and the posterior iliac spine, where we are keeping the hand front, anterior, both anterior, posterior, superior, anterior, inferior. In the back side also posterior, superior, and posterior inferior. And the concave part means it is like this, like this. So this particular concave part is called as what? Iliac fossa. So this is the iliac crest. You can see this is also called as a coxal bone. These are paired ischium, femur, and acetabulum. So the next part is called as ischium. Okay. So what is ischium now? Where we are resting means where we are sitting. That particular part is here on the ischium. Ischium is what? It is a thick lower part of the hippo. In continuation with the innominate bones, you can just see a lower part. Lower part is what? It is a very thicker part, and that we are calling it as what? The hippo. It is having how many parts? It is having the acetabulum. Okay. There is ischial tuberosity is there. Okay. And the ischial spines are also there. Okay. Then ischial spines. Why we ischial spines are important? Because ischial spines we locate. Okay. We locate the fetal head. That is above the ischial spine, we say it is minus, and below the ischial spine, we state it as the plus station. And at the point of ischial spine, if it is there, we state it as what? Zero station. We have a greater sciatic notch. Okay. And this notch is extending from where? From the sacroiliac joint to the ischial spine. Then there is a lesser sciatic notch that is extending from the ischial spine to the ischial tuberosity. Then there is an obligatory phenomena that is passing of the nerves, that is the pelvic nerve fibers are being there. So we have seen about the two innominate bones. Okay, then we have seen about the ischium. Now we are going to the symphysis pubis bone or the pubic bone. That is the frontal portion. So this symphysis pubis bone, that is from the anterior part of the hip bone, and it is also having some of the parts, that is the inferior ramen, the superior ramen, okay, and the symphysis pubis. This like this way will be there, like this way will be there. So they come together like this way, and they are joining here. Okay. So this one is the inferior one, this is the superior and one, and where they are joining, that is the symphysis pubis. And where they join, they make an angle or they make an arc, that we are calling it as one subpubic angle. So that is the complete about the innominate bones. Innominate bones have been divided into three types: the ilium, the ischium, and the pubic bone or the symphysis pubis. Okay. Ilium, the upper flare part. Okay. Ischium, the lower part. Symphysis pubis, the front part. So the next part is the sacrum. So in the sacrum, that is, it is a wedge-shaped bone, and this wedge-shaped bone is made up of 5 fused bones. Total together of 5 bones have been fused to make one bone, that is the sacrum. The sacrum is having the following parts. So which are the parts of the sacrum? The sacral promontory, that is the bulged part. This part is the sacral promontory, and its prominent margin of first sacral vertebra is projecting water inwards. Then there is a sacral iliac joint. Then wings of the sacrum or ala of the sacrum is there. Then there is a hollow of the sacrum, that is the concave part. You can see this sacrum, the fusion, that is a wedge shape or a triangular bone, fusion of the 5 bones. The front, this upper part is the sacral promontory. Okay. The sacral, this is the concave part, that is the second concave part. This is the ala or the wing part. The next part is what? The coccyx part. Okay. So what is this coccyx part? That it is a vestigial tail, and it is consisting of 4 fused vertebra forming a small triangular bone. There are 4 bones, and they are together, are coming, and they are forming what? They're forming some wedge shape, that means there it is articulation is there. So that coccyx it is forming. Then this coccyx is articulated, means it is attached with the sacrum. It is joined with the sacrum. But coccyx, what happens? This coccyx bone is moving front and back during the childbirth. This is the movable bone. Somewhat it is moving. So that's all about the pelvis. That is the main bones of the pelvis. So in next class, we are going to see about the ligaments, landmarks, diameters, and we will in the upcoming class. Thank you.